Hello, my name is Bree and I'm going to be your nurse for today. I'm here to perform a full head to toe assessment on you, which involves me assessing your skin, your heart, your lungs, your abdomen, and your muscles. Do you have any questions for me?
No.
Okay, can you tell me your first and last name?
Alexis Postel.
Okay, and your date of birth?
June 19, 1986.
Excellent. So I'm going to check your armband. Okay, perfect. And Miss Postel, can you tell me where we are right now?
Murfreesboro, Tennessee.
Okay, and can you tell me the year?
2021.
All right, so patient is alert and oriented ×3 to person, place, and time. All right, so Ms. Postel, before we get started, I do have a consent form that we will have to have signed in order for me to complete the head to toe assessment that we're going to get done today. Okay, excellent. So we'll lay this right there. So I'm going to wash my hands, and before we get started, I do need to get your blood pressure. Do you have a preference on which arm we use?
This one, the left one is fine.
Okay, perfect. So I'm going to get this arm propped up, and we're going to get that up to heart level. Let me get this put on you. Excellent. Get that cuff off of you. All right, so your blood pressure is normal. It is 120/70, which is excellent. All right, so now we are going to go to the eyes. So the eyes are symmetrical to the face. The brows are symmetrical to the face. There's no signs of any infestations to the brows or the lashes. The cornea is clear. The sclera is white. The conjunctiva is clear. There's no redness. There's no signs of any abnormal drainage. And there's no abnormalities that are noted to the eyelids, such as drooping either. So now, Ms. Postel, if you would just look straight ahead, pick a spot on the wall. I'm going to shine a little bit of bright light into your eyes to assess your pupils. Excellent. All right, and again, staring straight at that spot on the wall. I'm going to shine my pen light, and the closer my pen light gets to you, you just focus in on that light, okay?
Okay.
Excellent. So Perla for the pupils, they're equal, they're round, they're reactive to direct light, and they do also accommodate. The pupils are at about a 4 millimeter. And again, no abnormalities noted to the eyelids. The cornea is clear, the conjunctiva is clear, the sclera is white. No redness, no abnormal drainage, and no signs of any infestations to the lashes or the eyebrows. So now we're going to go to the ears. If you just kind of pull your headband back there for me. Excellent. So the color to the ears is tan. It is even. The shape of the ears is round. There's no signs of any abnormal drainage. That's noted. So we're going to shine a little bit of light into the ears. Excellent. So the tympanic membrane is great, and it is reflective to the light, and again, no signs of any abnormal drainage. So now we're going to go to the lips. So the lips are symmetrical to the face. They are pink, they're moist, no signs of any lesions, no cracks of any sort that are noted, and again, they are moist. So Ms. Postel, if you could just open up and say "ah" for me. Excellent, and lift your tongue. All right, and pull your bottom lip down. Excellent. So the teeth are white, the gums are healthy, the oral mucosa is pink, it's moist, it's intact, no signs of any lesions, and no abnormal bleeding, and no dental caries that are noted either. All right, so now we're going to assess the neck. So there's no jugular vein distension on either side. And Ms. Postel, you just let me know if you have any pain, tenderness, or discomfort as I touch you. All right. Any pain, tenderness, or discomfort?
No.
No. Okay, so the trach is midline. So now we're going to feel for the carotid pulses. So we're going to feel here. Excellent. So the carotid pulse for that left side there is at a 2+, so that's normal. So now we're going to feel over on the right side here. All right, and again we're at a 2+, so they're normal for both sides. And now over here we're going to check for the skin turgor. So we're going to pinch up here, and the skin turgor is normal, and it has a brisk elastic recoil. So now we're going to move to the skin. So Ms. Postel, if you could just hold your arms out for me. So we're going to look at both of the arms. So the skin color is tan, it's even. The temperature is warm, the skin is intact, we have an equal hair distribution, there's no signs of any vascular abnormalities, no bruises, cuts, scrapes, or insect bites. And again to the hands, there's no abnormal vascularities, cuts, scrapes, bruises, insect bites, and we don't have any signs of any pallor noted to the arms or the hands. So now we're going to move to the nails. So the nails have a square nail bed. They're translucent and they are intact, and they do have a free edge. We're going to check the capillary refill. So the capillary refill is less than 3 seconds, so it's normal. There's no signs of any clubbing or any cyanosis. So now we're going to turn your hands over, and now we're going to feel for pulses. All right, excellent. So the pulses are normal bilaterally, and they are at a 2+. And now we're going to do your grips. So Ms. Postel, if you could grip my fingers for me. Excellent. So your grips are equal bilaterally, and they are also at a 5+. Okay. So now we're going to move to the lower extremities. All right, and we're going to kind of do the same thing as we did for the upper extremities. So we're just going to feel here. And again, we have a tan color that is equal to both sides, and it's even. We have equal hair distribution, no cuts, scrapes, bruises, no signs of pallor, no vascular abnormalities that are noted. The temperature is warm and the texture is smooth and the skin is intact. So we are going to check for pretibial edema. 1, 2, 3, 4, 5. All right, so there's no signs of any pretibial edema noted to the bilateral lower extremities. And now we're going to check for some pulses here. All right, excellent. So the pulses are equal bilaterally, and they are at a 2+. So the nail beds are also square, they're translucent, and they are intact, and they do have a free edge. So we're going to check for capillary refill. The capillary refill is less than 3 seconds, so there's no signs of any clubbing or cyanosis. Now, Ms. Postel, if you could just press your feet against my hands. Excellent. So the plantar flexion is normal, and it's at a 5+. So we are definitely good there. All right, so now we are going to wash our hands. And now, Ms. Postel, we are going to move to the lungs. So before we get started, I'm just going to do a little bit of inspection. So I'm just going to take a look at you. So we have a normal respiration rate. The precordium is normal. There's no heaves or lifts that are noted. Ms. Postel, can you take a deep breath for me? Excellent. So we have a normal symmetrical rise and fall to the chest. And now we are going to take a listen. So I'm going to listen to about 8 different places on the front side. We'll listen to about 10 different places on the back side, and then 1 lateral, which is going to be right up under the right arm. Okay. So I'm going to warm my stethoscope up just a bit. And with every place that I touch, you just take a deep breath, okay? Okay. All right. 1, 2, 3, 4, 5, 6. All right. And now I'm going to use this drape, and we're going to have to go up under your tank top just a little bit for us to listen to 7 and 8. Okay. 7, 8. Excellent. So the lung sounds are present bilaterally. The lung sounds are vesicular. No adventitious lung sounds that are noted, like crackles or wheezing of any sort, and they're present in all lobes. So now, Ms. Bosso, we're going to listen to the back side. So if you could just turn to the right side for me. And listen here. Now I am going to lift your tank top up so we can get to those lungs a little bit better. And I apologize, my hands are super cold. All right, excellent. All right, so again, with every place that we touch, you just take a deep breath, okay? 1, 2, 3, 4, 5, 6, 7, 8. All right, we're gonna go up under here. 9, 10. Excellent. So we'll pull that back down for you. And now we're gonna go to that lateral side, and we're gonna listen up under that right arm.
Okay.
All right, so if you'll just lift your right arm for me. All right. And again, take a deep breath for me. Excellent. All right. So we'll keep it right there.
Okay.
So again, on that back side there and that lateral side, the lung sounds are present in all lobes bilaterally. They're vesicular lung sounds, no adventitious lung sounds that are noted, like crackles or wheezing of any sort, and they're not diminished to either. So the lung sounds are very clear and they're normal. So now we are going to move to the heart sounds. So I'll go through and I'll listen with the diaphragm and my stethoscope, and then I'll go back through and listen with the bell of my stethoscope. So now this time, whenever I touch you, you just breathe as normal, okay? We'll get this one back up for you. All right. So at the second intercostal space to the right sternal border is the aortic. And then also in the second intercostal space to the left sternal border is the pulmonic. All right. And then move here. So in the third intercostal space to the left sternal border is the Erb's point. All right. And then we can go either under your tank top or we can go down under your tank top.
Easier to get it.
Okay. So in the fourth intercostal space to the left sternal border is the tricuspid. All right, and then we'll go under your tank top and we'll get into the fifth intercostal space to the mid-clavicular line, which is the mitral, or also known as the apical. And we're going to listen here for 1 full minute and get an apical pulse on you. Okay, excellent. So the apical pulse is a 74, which is normal. For all heart sounds isolated, there is a distinct S1 and S2. There's no additional heart sounds that are noted, no splitting, no galloping, and no murmurs that are heard. So now we're going to go back through and we're just going to listen with the bell of the stethoscope. All right. So again, we're going to start here. We're in the second intercostal space to the right sternal border, which is the aortic. Okay, and then we're also in the second intercostal space to the left sternal border, which is the pulmonic. Okay, now we're in the third intercostal space to the left sternal border, which is going to be Erb's point. Now we're going to get down in between like we did earlier. Okay. We're going to get into the fourth intercostal space to the left sternal border, which is the tricuspid. All right. And then we're going to go under like we did before, and then we're going to get into the fifth intercostal space. That's here, and this is in the midclavicular line, which is the mitral, or also known as the apical pulse. Okay, excellent. So we can pull that back down. You are good to go. So again, there is a distinct S1 and S2. There's no additional heart cells that are noted, no murmurs, no splitting, no galloping, and there's a regular rate and rhythm associated with the bell and the diaphragm for all heart sounds. So before we move on to the abdomen, with assessing your lungs, I am going to assess the diameter of your chest area. My apologies on not getting this done before. So we are going to assess here. All right, so the AP is less than the transverse, which is normal. So now we've gone through the lungs, we've ascertained the heart. So now we are going to move to the abdomen. So now, Ms. Postel, this will involve you having to lay down. So if you could do that for me. Excellent. All right, so before we get started, we'll again do an inspection. So we're going to look down and we're going to look across. So the contour is round, it's flat, there's no abnormal masses that are noted. So now we'll do an inspection. Lift your tank top here. All right, so we have an even color, some scattered striae. The umbilical is midline, and there's no signs of any abnormal drainage that's noted. So now we'll go through and we'll listen to your bowel sounds in your 4 quadrants. Excellent. So the bowel sounds are present in all 4 quadrants, and they are normoactive. All right, so now we're going to go through and we're going to do a light palpation to all 4 quadrants. So this will just involve me using one hand. And if there's any pain, tenderness, or discomfort, you just let me know. Any pain, tenderness, or discomfort? No. Okay, now we'll do a deeper palpation, which is going to involve me using 2 hands. Excellent. Any pain, tenderness, or discomfort? No. Okay, so there's no signs of any enlarged organs. Again, no masses, no pain, tenderness, or discomfort, or muscle guarding. So now, Ms. Postel, we are all done with the abdomen. So now if you could just stand for me, we are going to take a look at your spine. So the spine is symmetrical to the body. Ms. Postel, just let me know if you have any pain, tenderness, or discomfort noticed with palpation. No. Okay, good. All right, and if you could just bend over a little slightly for me. There's no signs of any lordosis, scoliosis, or kyphosis. And now you can just stand back up. Straight. Any pain, tenderness, or discomfort? No. Okay, now you can have a seat for me. All right. Now this does conclude our full head to toe assessment. Do you have any questions or concerns for me? No. Okay, so I'm going to go wash my hands and get this documentation done. And thank you for your time.